Okay, folks, welcome back to our show. I'm very excited to be joined here by Trevor Storrs, the CEO and President of the Alaska Children's Trust. How you doing, Trevor?
I'm doing well, Jeff. Yourself?
I'm very good. I'm excited to talk about the Children's Trust. But first, I think maybe the reason you're here in the last 10, 11 days, you've probably got a lot of text messages and phone calls about an interaction that occurred in the House Judiciary Committee early last week.
Yeah, we've gotten a little attention over the past couple days.
So you were there for some background, and we tweeted this little clip out we'll talk about in a second, but probably one of our biggest tweets ever, reached almost 2 million people. So,
well, you're welcome and congratulations.
Well, I wish I was making money for my tweets. So tell me why you were at the House Judiciary Committee, and then we're going to go into this little interaction that occurred.
Absolutely. So the chair, Representative Vance, invited us to come in and speak about what's called adverse childhood experiences. Many, like herself, that are past legislators have learned about adverse childhood experiences and really felt that the new legislators that were coming in should also learn about this. So she invited us to come in. So myself and a couple epidemiologists that we know joined us, one from the state, one who's a retiree, and just came in and talked about what happens to a developing brain when they're exposed to what we call toxic stress. And that's how it started. And it was a wonderful day.
This is like mental, physical, mental, all these different kinds of abuses,
right.
Environmental.
Well, really, it's understanding toxic stress is under that constant threat of, which could be a form of child abuse and or other activities. If you look at adverse childhood experiences, they'll talk about the different adversities and how it plays into brain development, and how it's been linked to many of the physical, social, and behavioral ills that our society is dealing with, whether we're talking suicide, judicial system, homelessness, liver disease, heart disease, smoking, all these things that we've been trying to deal with as a society. It's really actually showing if we do upstream work and prevent toxic stress, we could have a great impact in reducing the risk and the likelihood of those things happening.
So you were there at this committee meeting presenting on this, and
yes.
Representative Eastman asked you a question. We're going to pull that up in a second. And I feel like that moment has become kind of the focal point for
unfortunately, yeah.
And that was these hearings last an hour, sometimes 2 hours.
We were very honored to have an hour and a half. They normally allow you 20 minutes, but Representative Vance gave us the whole committee time so we could really go in depth, hence why it wasn't just me presenting, but a couple other experts to come in and share the information. And there was many great questions all throughout. Unfortunately, rather than us talking about the kids and the information and why we should be talking about primary prevention, a lot of attention has been given to the single question, which is really quite irrelevant.
Well, let's just show the video real quick, and we can talk about what happened, and then we can go into more about the Children's Trust.
Sounds great.
Also, we'll talk about I think he was trying to make the point, but he didn't make, and he made
right
in a really bad way. So
yeah.
Let's pull up, we'll have Trent and our guys pull up the clip here. Go ahead and play that. And here you are, Trevor, there you are.
In the case where child abuse is fatal, obviously it's not good for the child, but it's actually a benefit to society because there aren't needed for government services and whatnot over the whole course of that child's life.
Through the chair, can you say that again? Did you say a benefit for society?
Talking dollars. Now you've got
yes.
a $1.5 million price tag here for victims of fatal child abuse. It gets argued periodically that it's actually a cost savings because that child is not going to need any of those government services that they might otherwise be entitled to receive and need based on growing up in this type of environment.
Through the chair, Representative, I guess that would be the idea, if I can use a really bad analogy.
That's really funny.
When you hit somebody, always back up because it's cheaper to insurance. I don't pertain to that, and I'm really, I'm not even sure how to answer that there's a cost saving to the death of a child. The impact that has on a family and us as a society when a child is lost, especially to child abuse and neglect, is unmeasurable. And it's hugely tragic.
And follow
up.
And the way that you're calculating this 1.5 million, and when I say you, I mean the people who did calculate it, does that 1.5 million get higher or lower depending upon the age at which the child is killed?
So again, there's multiple factors, and a number can definitely increase, but again, I don't believe it's going to matter if they're older or younger. Again, a loss of a child is really unmeasurable.
So I think the point, and he's since kind of, he went on the Bob Lester show, I don't know if you heard that.
I did hear it, yes.
I think the point he was trying to make was, well, okay, people who are pro-life, very pro-life, if you have an abortion, that's one thing, but then if the kid is born and, you don't want to have the kid, die. I think that was the point he was trying to make, but when you even clarify, I mean, you must have been, first of all, when that question got asked to you, you must have been like, you even said kind of you were shocked.
I wanted clarity. I heard the question, and I came away with the impression that there might be something else in what he was doing, and gave him the opportunity to rethink the question and present it. So in much of his interviews, I can't speak to his intent, but we can now assume, because he's been sharing what he's trying to do. Mm-hmm. And either way, one, as a guest in the legislature, you don't try to play a gotcha. I wish if he had a question, he would have been as truthful with me as we were with the committee, and just ask the question.
I mean, I think that maybe what potentially the point was is to get a gotcha and have you say, of course we don't want to, killing a child is horrible, and then maybe they want to in the future use that statement against you and pro-life kind of campaign.
And everything he's doing, he's making a lot of assumptions, and they're really incorrect assumptions. One, he's making assumptions of what the Alaska Children's Trust stands for, and when it comes to abortion, we have no stance. And what's most important to realize is when we've been having a conversation about this, we're talking about data related to kids. I think it's really important that viewers understand there's a national ranking in our nation through the Annie Casey Foundation. It's called Kids Count. We share it every year. We're 41st in the nation out of 50 states for child well-being. We're always in the bottom half, and for about a decade, we're usually in the bottom third, always in the 40s. We have some of the highest rates of youth suicide, depression, use of substances, everything and anything you can think of. We do have some glimmering hope and some really good areas, but overall, we're not doing well. What we need to be focusing on is having that conversation. I wish that Representative Eastman would have given us the same respect as we were giving. We might have some differences, but I truly believe even with him and all those people in the committee, we have some common values, and that is kids are important, they're valuable to us as a society, and not in the sense of money and numbers, but they're our most precious resource. And how do we make sure they're on the right footing so they can be those contributing members that we want as adults?
Well, and kind of the thing when he said that, the thing that I thought about was the old George Carlin bit. He says a lot of these pro-life people are pro-life until you're born, and then once you're born, you're on your own. And there isn't as much money invested, in a lot of, children and whether it's, their well-being, education.
Well, I think there's a challenge out there with that, and that's always been the conversation that we've been having, and that's why we're doing the ACEs study. So you can always look at tertiary. So there's three types of prevention. There's primary, which is upstream, get involved before something happens. Then there's secondary, you're on the edge, you're kind of in that circle, and tertiary is afterwards. This is really easy to measure because when something has happened, then you can go clean up. Let's take earthquakes. When an earthquake happens, you can look and go, oh, yeah, these buildings, these people hurt, let's now take care of it. So it's very measurable. Secondary, it's kind of when the buildings are shaking, and you're like, yep, we're gonna have some problems here. Primary, because you prevent it from happening, you can't measure it happening because it hasn't. But again, if we think about earthquakes, why do we have all these building codes? Think of 1964. We as Alaskans experienced firsthand what an earthquake can do. We have transformed our building codes because we don't want to wait to intervene after the earthquake. We want to prevent it from happening. In 2018, when we had that major shake, look at the amount of damage that happened in Anchorage, which was minimal compared to outside who don't have those same primary prevention upstream codes. They experience more. That's what we were talking about. And then unfortunately, Representative Eastman made some assumptions that were absolutely incorrect. and took us off in another direction, which wasn't necessary.
So first I want to ask you, after that video, we put that video out and it got, I mean, a lot of local, state, national attention. I'm sure you probably got some texts or some phone calls. You were kind of featured in there, so.
Right. Well, at first, not everybody, if they knew who I was, they know my voice and they knew it. It took about a day for my name to actually get connected with it. And yeah, we received a lot of outreach from folks, really concerned about the question, but really appreciative of how it was responded to, and that we as an organization and that all three of our presenters really kept the focus on what's most important is the kids. And why do we need to invest early to prevent these adverse childhood experiences, and to make sure the child, the family, and communities have what I call the knowledge, skills, supports, and resources to thrive. Because when they're thriving, their likelihood of experiencing child abuse and neglect, or many of the other adversities we were talking about, is greatly reduced.
So some of these experiences, I mean, I assume things like fetal alcohol syndrome, and then after they're born, household issues, family issues, abuse, all these factors can be considered an adverse childhood experience.
Yeah, there's a lot. So there's different forms of child abuse. There's 5. So adverse childhood experiences, some people just look at a study that was done. They only looked at 10 adversities. 5 were related to child abuse and neglect, and 5 were related to household challenges, which was primary care provider experiencing mental health, substance misuse, divorce or single parent, incarceration, things of that nature. And really what it is when you get exposed to these things, or the household dysfunction limits your ability to access the knowledge, skills, supports, and resources to thrive, you're at higher risk of experiencing toxicity. And that really impacts the brain, because most people don't even realize the brain, until age 5, 90% is developed, but you don't have a fully developed brain until your mid-20s. We really want to make sure, and the brain is the only organ that is not fully developed. I don't mean by size. Our heart is fully developed, but it grows. Our brain grows, but isn't developed. That first 5 years is so important. And research after research shows if you want, let's talk money. Our state has a budget, right? If we want to really have a balanced budget and stop having to see increases in Medicaid, in our correctional system, all these things, we want healthier people and people that are committing crimes and homelessness. You do early investment. $7 to $13 return on $1 investment. If you invest in jails, you get no return.
Well, I know this is probably kind of not directly related, but there's been so many studies that have shown, the vocabulary of a child by the time they're 10, is a huge predictor of their education level, their income level. It's because by that 3rd grade, and this is the Alaska Reads Act they passed last year, because we're very low, we're like almost last in reading. But if you can't, get those skills in reading by the time you're in 3rd grade, it becomes so much more difficult to develop those when you're older.
Well, and I love that you used the word predictor, Jeff. That's what we were talking about, and that is something that Representative Eastman latched onto. Like, he misconstrued. We know that if you have, we've been working with, the state has been doing some great research, and that's what Dr. Jared Parrish was sharing. And it's been a longitudinal study, and it's predicting, it's showing that when a family is experiencing homelessness, there's a higher risk of experiencing child abuse and neglect. When a family doesn't, and so these predictors, and what he was saying is, if you can predict what's going to happen, you have a better chance of preventing it. So, before a child is even born, if there's a family that's experiencing homelessness, let's help them deal with the homelessness, get them housing, get them stable. So when they choose to have a family, that child is not at less risk of experiencing adversity, or that family entering the child welfare system.
So I think there's probably 2 ways to look at this. There's what can the government do to help these things, and I'm sure some people always say, well, it's really, when you mentioned this, divorce and the family, I was raised luckily by 2 parents that were together, but I have a lot of kids growing up that I knew the parents got divorced, and that was a very difficult, experience. It's usually a difficult experience for especially younger kids. So I guess maybe talk about, what the role of the government is, the state, and then the role of the kind of the family
Right.
in this stuff.
So let's actually step back and just talk about what is the role of us in really preventing child abuse and neglect. And before I answer that, I do want to make a really good clarity. Divorce doesn't mean it's a toxic experience or adversity. It's because when you are a single parent, your level of income and access to supports and services are reduced at times, and that's what puts you at a greater risk. So it's not the act of divorce or being a single parent. Really want to make that clear for folks.
But sometimes if it's a nasty divorce and there's fighting, that's what I was.
Well, yeah, that
talking
never
about.
helps, especially when a child is put into the middle of things. But if we think about what is our role, well, we talk about it as in very holistic. We all have different roles. Whether we're talking within our own family nucleus, to the extended family, to our neighborhood, to our community, to our city, town, to our state, and then on a national. We all have different roles. And what we were sharing with the state folks was, this is what's going on, and then at the very end, we talked about what could they be doing. But we I don't have kids, but my brother does. I have a role in how do I support them in making sure that they, again, have that knowledge, skills, supports, and resources. As a community, we volunteer. We make sure there's parks, there's safe space, things of that nature. As a city, we have a role. So we all have different roles.
This might be a bit of a cliche, and some people might not like this phrase, but it does take a village. I mean, there's a family, but then there's, like you said, there's the community, the local neighborhood, the city,
I will
the
switch
state.
it a little bit, though. It takes parents to raise a child. It takes a community to uplift those parents, because the parents do have that responsibility. And we're very proud in our state that parents, that is their job. We never want to circumvent that. So it takes parents to raise a child, hence why we want them to have the knowledge, skills, supports, and resources to be successful parents. And how do you do that? As a community, we uplift them and make sure that they have that.
So why do you think, or what are some of the reasons Alaska's, you gave these statistics earlier about we're very 41st, or we're very low on, or I guess high but low on these rankings of this adverse childhood experiences. Why is that?
Well, there's a variety of reasons. Some of it is, and let's talk about government's role. I think one is where they're putting their investment. So if we look at history, and we did what's called the Alaska Children's Budget. It's 2 years out of date, but it looked from basically 2011 through 2020 and compared the budget. We know that we've decreased
The budget for what?
For the state budget.
Oh, the full budget.
The full budget. We have decreased investment about 13% overall in those past 10 years. That's $400 million. Doesn't seem like a lot, but when you actually have an overall small budget that we have, $400 million.
Well, it's about 10. I mean, the budget's about $5.
Right.
Give or take about $5 billion. So.
Right. So we're putting in less towards children and families. So that's a piece of it. We also know when we look at investment, it's going into tertiary, those three areas that I talked about. We see increases occurring in corrections, but yet we'll see a decrease in preventative things like early childhood. Early childhood until last year, and thank you for the governor and the amazing work of our legislature, the bipartisan work that happened. We got the REACH Acts passed, and that included pre-K and preschool. Thank you for doing that. Great investment, but that's a small investment compared to what we do for corrections. Until we start really investing that upstream, that preventative work, we're going to continually see this. So those are, so that's sometimes the cause of what we're doing. Also, it's recognizing that, well, what's preventing people from getting the knowledge, skills, supports, and resources? Healthcare is a piece of it. We are currently 5th in the nation for kids without health insurance.
Well, I have this,
things of that nature.
We have this Landmine Book Club, and last year we read a book called 1 Billion Americans by Matthew Iglesias, and the argument was we need more people, we need 1 billion people, which would still have a lower density than all countries in Europe. And he talks about being competitive globally. And one of the things he talks about is you can add people by 2 ways, birth or immigration. And he thinks both should be a role. But with birth, you have to encourage, we have a very low birth rate now, lowest in many, many decades. And part of it is the health care and the child care as well. And I remember at our book club meeting, there was a bunch of parents, and I just said, hey, just curious who would have more kids. And some of these are high earning people. I mean, there's people who are earning well over $100,000, $200,000 a year, which is a lot of money. But if you look at the cost of it's $1,000 or $1,500 a month for childcare, and then if you're self-employed, the healthcare element, and like most of the people said they would have had more kids if they didn't, if they didn't, if these barriers weren't in place.
Yeah, I wish I knew the numbers, but just looking at costs of raising a kid has greatly increased beyond inflation rate. I don't have those numbers, but I do know that it has not even come close to what inflation is. And I don't mean just last year, in general. And inflation rate is usually 2 to 3%, give or take, except for the past year or two, and it was much higher than that. So the cost. But I appreciate you talking about childcare. We're really excited here, Anchorage-based. I know that people are going to be watching this, but
You guys have a new there's a ballot initiative.
There's a ballot initiative to create an early childhood fund.
This is on the Anchorage ballot for the upcoming.
On the Anchorage ballot,
upcoming April.
And we'll come back and talk to you more in detail, but we are looking at what are the ways that we can support communities to truly invest in that upstream. So what does that look like? And I think Anchorage residents, they really want this kind of investment. And we're seeing other communities look at this. Juneau has already been doing it. They've included it in their appropriations, really doing an investment and really making sure that families, again, have that knowledge, skills, supports, and resources. Because when they're thriving, you're going to have less crime. You're going to have less poverty. You're going to have less medical issues. And you'll have more of a thriving economy. And more people are going to move there. Businesses are going to be there. You're going to have better parks. You're going to have a better community. So it's really a true investment in the whole community and family network.
So I probably should ask you this before, but real quick, talk about what is the Alaska Children's Trust? When did it start, and what's the role?
Yeah, we're just making the assumption that everybody already knew us. So the Alaska Children's Trust is a statewide organization focused on the prevention of child abuse and neglect. And again, kind of back to one of your questions, a lot of people go, well, how do you do that? Because it's such a complex issue. No single cause, no single solution. Well, I talk about it as life is like an elastic band. When you experience stressors, positive, negative, or toxic. Positive is, I've got a test tomorrow. That's a good stress. Negative is, I got a D, but we're going to be fine. Toxic is, I'm going to go home and get hit for it. So understanding. But either one, they will add stress. Toxic is a lot more stress to that band. You stretch it compared to positive. But if you don't have the knowledge, skills, supports, and resources to address that stress, it stays there. And then life is full of stressors, and you keep adding, and you can't get rid of those stressors.
Well, there's been countless studies showing that stress is a big part of heart disease.
Right. And those are
stroke,
those three.
All kinds of health.
But you stretch an elastic band draft too far, what happens?
Breaks.
Yeah, that's when child abuse and neglect happens. So we talk about everything we do is how do we help children, youth, families, and communities get that knowledge, skills, supports, and resources to lessen that tension. Because when we do that, we reduce the risk of child abuse and neglect.
So when was the trust formed? You say trust, I assume there's some endowment or there's some money that...
Yeah, the trust was originally formed in '88 in name only in the state of Alaska. Advocates worked really hard to get that, but there was no funding. In the mid-'90s, under the Knowles administration, he focused in on kids. They retooled and got the trust endowed. In 2012, through the support of current and past governors, the legislature, and the community of advocates, agreed that for the trust to really be successful, which is to prevent child abuse and neglect, we need to be out from underneath the state umbrella. So we moved out from underneath that, and that's when I joined them, which was 11 years ago. And we have been really focused in on the prevention of child abuse and neglect.
So unlike the mental health trust, the state doesn't do your budget or in control.
Yeah, we're completely independent now.
So, we talked about these problems the state faces. I mean, what's your outlook? I mean, can we improve these? How do we have to improve these? What do we, what's the way to improve this?
The way we've been talking about it is if we really want a well-balanced and sustainable budget, we need to invest. It's kind of like if you want to retire with a good nest egg, you don't start investing at age 60 and retire at 65, right? You start early. Well, that's what we have to do. And we've done so many cuts to all the primary prevention services for so long. We are so far back. We're unbalanced. So you can invest here. It's not going to change it immediately, but we need to invest equal or greater to start getting this to have less of the tertiary problems and more of the success.
What do you know, like, what's an example of a state that's number one, or really a state where this is?
Well,
these are-
each state has different successes. I think a really good example right now that, I really appreciate when the legislature came together and was talking about Representative Eastman, but if they really want to address what happened at the legislature, I'd love them to see them pass things like the postpartum bill that's being put forward. It's really supporting women after pregnancy. Postpartum is a real impact and puts families at great risk. Doing things like that. That's the primary prevention. Really having open dialogue and understanding what is human development and how do we teach that? Because we know when kids understand human development, it actually prevents child sexual abuse, which is a huge toxic stressor in life, experiencing that, to also developing healthy relationships. We know one of the ACEs is being in a family with domestic violence, and there's a current bill being passed and being looked at related to that. But if we don't want domestic violence, let's make sure our teens, who are going to be our future parents, have the healthy relationship skills they need, which greatly reduces domestic violence. Those are the things that we can be investing in and doing that will greatly impact many of the statistics that we've talked about.
Well, not another state, but another country. I lived in Australia for almost a year, and I was kind of amazed that in Australia, if you have a kid, you get a year off, and it's you don't make as much as you would make but there's a kind of minimum wage, and they have to save your job. So a friend of mine, they had the second kid, now they had the third kid. She's a teacher. She gets a year off. They have to hold her job, and it's not just private. It's public. It's private too. They have to do that, and that's according to my friends that I've talked to. It's a very they say, I don't know if I could have a kid if I had to go back to work in a month.
Right. The research constantly shows that paid family leave is really key to the success of early childhood. So if we don't want them to go into childcare, then we need a way for our parents to be able to stay home. And what does that look like? I don't know which states have implemented it. I'd have to look it up. But I do know actually at the Children's Trust, we actually instituted what we could do. People get actually 12 weeks pay, which is unheard of. And that's not under FMLA. We created what we could for family leave.
Family leave, medical act.
And that is small amount that we're able
I know
to provide. But the city's looking at it as well.
Some bigger companies, I had a friend in New Mexico that I grew up with, and he was working at the time at I think Bank of America, and they did a thing where they did 3 months of not just maternal, but paternal, which is a private, big company that can maybe a little easier for them than smaller companies. But, but in Australia, it's a law. I mean, it's not it's like that's what you have to do. And the government, I think, pays that 1 year of and it's not your equivalent of your salary if you're earning a lot of money, but it's enough to, it's something. And then also they have to hold
Canada does the same thing in different countries. And we need to start looking and having these conversations.
We're like one of the only countries, it's like us and, I forget, maybe Albania or something. It's like us and one other country that doesn't have this national policy of family
Yes. Leave. Yeah. I don't know if it's just two, but very few of us.
But as far as Western, like Europe,
yes.
They all have it.
Right. Yeah. And if we thought about it as, so what do we do? Because I think there's some pushback of why am I paying for somebody else's to have children, things of that nature, or again, our structure in Alaska and kind of the last frontier approach to things.
Well, that goes back to the new people and population. You need workers to fund Medicare, Social Security.
But
you have
how
to have
do we,
people, it's a societal.
How do we get into a place to have these conversations? So one of the things we've talked about is, and we were always hoping the current governor would look at really establishing a children's cabinet. Because again, we got cabinets for other things, but our most precious resource we don't. Because how we raise kids impacts natural resources, fisheries, as well as health and social services and ed. It impacts everything. And for legislators, we had it didn't really do much. They tried, but I'd love to see a children's caucus formed. And then there's strong coalitions of the community sector around kids. But if you had those three things going and they were working jointly, we could be looking at these things and figuring out and really asking the question, not how much money do we have and what are we going to do with it? Let's start with what do we want our kids to be and then let's look at the resources.
I don't have kids like you, but I have a lot of friends with kids, and I'm reminded of a story. A friend of mine many years ago was a big brother. He volunteered, and he had this great kid from Mountain View, and one day he took him out on a hike, and the kid was 11 or 12, and he took him in the mountains and took him on a hike, and he said the kid was really like, this is awesome, and he said something like, well, it's so lucky you live here to be able to do this, and he said, this is the first time I've been in the mountains.
Right.
I mean, the kid's from Anchorage, but never went on a hike.
Yeah. Well, I think what you just outlined is one of those examples of people have been asking us after Representative Eastman, what can we be doing? That's an example. It's not about what can we do about Eastman, it's more of what can we be doing for our community. How do you volunteer, give back? How do you give that kind of support? Be a mentor, be a coach. Look at your profession. Can you be teachers? I know we need teachers. Or if you've got the time, how do you be a substitute? How do you be a safe haven for your kids' friends? Many of our friends that our kids have, we know that they may not have the best family life. How do you be a support to that? There's always things that we can be doing as a community on top of what can we be doing as a legislature or government. Because we truly believe systems and or laws can either prevent or unintentionally perpetuate child abuse and neglect. And some of the things we're doing is unintentionally creating the environment that is causing child abuse and neglect, which leads to many of these other issues that we're talking about. And if we go to this prevention side, we could transform Alaska. We could make this truly live up to what we all want it to be, the best place to live.
Well, it's just like people's health care, they say an ounce of prevention, going to the doctor, getting a yearly checkup.
Exactly.
They catch something early that if you wait and 5 or 10
Primary
years, it
prevention,
could kill you.
And we have the data. And that's what we were sharing and continually share. Kids Count, we have that whole program. We show what the data is telling us. But it's not just, if we do this one thing, complex issue, no single cause, no single solution. There's different levers. We're going to have to play with each one. I kind of talk about it, it's like tuning a piano. You just don't tune one key. You have to do one and then do another and then go back, and it's always this kind of give and pull. That's what we're going to have to do to really get us out of. Because let's remember, these statistics did not happen last night. It's taken us decades to be where we are today. It will take at least a decade to change it, but if we wait till tomorrow, we're one more day late.
Well, that's probably a good note to end it on. And I want to ask you, are you going to have any plans to go back to the legislature, any more committee hearings?
Oh, absolutely.
I feel like you're going to be a hot ticket when you
we've already been asked to come in and share more data with the a couple committees, so we're looking forward to it. So maybe see you down there like end of March.
I'll be there. And then also we can maybe talk about this later, but there is this ballot initiative that
we'll come back.
That's for an Anchorage ballot here in April. So
fantastic.
Okay, Trevor Storrs, CEO, President of Alaska Children's Trust. I want to thank you for coming on the show and chatting. You're pretty famous in the last 10 days. So
well, thank you for that.
Yeah, appreciate it. Folks, thanks again for watching, and I want to thank GCI, our kind of course main sponsor here, for making live streams like this possible. I want to thank Trevor Storrs again, and I'll be in Anchorage this week, back from Juneau. There's going to be some assembly debates next week for all the assembly races, so stay tuned for those and tune in, and we'll catch you guys next time. Thanks.